We're here today to give you some important information about warfarin.
Warfarin is an anticoagulant or blood thinning medication commonly prescribed to cardiac surgery patients after surgery to prevent or treat blood clots. The most common reason people take warfarin is to prevent harmful clots that cause strokes in patients with abnormal heart rhythms, such as atrial fibrillation, or for patients who had certain heart valves replaced. A less common reason is for treatment of harmful blood clots, such as pulmonary embolisms and deep vein thrombosis. Warfarin inhibits your body's ability to form clots by decreasing the activity of natural clotting factors in your body. To make sure patients are safe and protected while on warfarin, lab testing, called an INR, is done to determine how anticoagulated a patient is, with higher numbers meaning they are more anticoagulated and lower numbers less so. Doses of warfarin are adjusted to ensure the optimal number.
After leaving the hospital, a visiting nurse will come to your home daily for the first week and take your blood. As patients are stabilized on a dose appropriate for them, blood work will become less frequent. Blood tests are reviewed by a provider in Bay State's anticoagulation clinic. The clinic will call you once the results are in and tell you what dose to take. If for any reason you don't hear from the clinic by 4 p.m., call the clinic to see what dose to take.
Warfarin should be taken between 5 and 6 p.m. in the evening, as instructed by the anticoagulation clinic or your provider, and can be taken with or without food. If you forget a dose and it is the same day, take the dose as soon as you remember. If it's the next day, immediately call the Bay State Anticoagulation Clinic or provider. The clinic will let you know what to do: resume the same dose or take more. The biggest concern is foods high in vitamin K, as these can decrease the effectiveness of warfarin's ability to thin your blood. However, as long as the amount of vitamin K in your diet remains consistent, we can adjust the doses of warfarin to take this into account. If you like to eat high vitamin K foods, such as spinach, leafy greens, or broccoli, keep doing that. Just eat a consistent amount. If you have a spinach salad 3 times a week for lunch, just do this consistently. Avoid alcohol when first on warfarin, as this can make it harder to get patients on a stable dose and potentially increase your risk of having a bleed or stroke. However, alcohol in moderation can be resumed once the surgeon has given the okay. Warfarin interacts with over 400 medications. Some of these make warfarin more potent and others make it less potent. Be sure to let your providers know if you start any new medications or stop any medications. These interactions happen with some non-prescription medications as well, including vitamins, supplements, and over-the-counter medications. Include these when speaking to your providers about starting or stopping new medications. The best practice is to make a list of all medications, vitamins, supplements, and over-the-counter medications you take, and keep this with you wherever you go.
As an anticoagulant or blood thinner, the most common side effect of warfarin is bleeding. Patients will commonly find that they will bruise more easily and that it will take longer for cuts or scrapes to stop bleeding. Abnormal bleeding includes cuts that when pressure is applied for an extended period of time and the bleeding doesn't stop. Large or painful bruises, bleeding of the gums, blood in the urine or stool, and nosebleeds that start without a reason. If you experience any of these, contact the anticoagulation clinic or your primary care provider. If you feel you have an injury and are unsafe, seek emergency medical attention.
Do your best to prevent dangerous bleeding. When shaving, use an electric razor. When home, wear shoes or slippers with rubber soles to prevent slips or falls. Be careful with sharp utensils or tools such as knives and scissors. While brushing your teeth, use soft bristled toothbrushes and waxed floss. When walking outside, wear sturdy shoes with good grip and be careful in the winter when it gets slippery. Avoid activities where there's a risk of getting injured, such as contact sports. Seek emergency medical help by going to a hospital emergency room or call 911 if you're hurt in a way that could cause you to lose a lot of blood or cause a bleed in a dangerous place, such as in your head. There are several places patients can go for more information. The first is the Warfarin Educational pamphlet given to you when you start on warfarin. If you haven't received this pamphlet, ask your nurse for one while in the hospital or call the anticoagulation clinic to have it mailed or emailed to you. Other resources available are the Bay State Anticoagulation Clinic, the Cardiac Surgery Office, and other healthcare providers or pharmacists.